In her study funded by Nuffic, Netherlands and Makerere University Research Innovations Fund, Dr. Achola's research entitled Decision Making About Family Planning Use Among Refugee and Host Populations in a Germany District points to the critical role of family planning in improving maternal and child health in refugee settings. Whereas limiting family size was identified as a key motivator to family planning use, Dr. Roselline's study findings revealed key dynamic pathways to decision-making processes in family planning. Among the notable identified barriers to family planning use included harassment by partners and the side effects of family planning commodities.
My study was big, complex, but I managed to investigate and my findings were enormous. Women go through a lot in this country, both the refugees and the host population. And given what they go through, they cannot access services easily, and that's why Dr. Laro said we still have high maternal mortality in this country. My study, if well handled, can support to reduce the number of women dying in this country and children. Because family planning is one of the cost-effective interventions that can help us to reduce maternal mortality and child mortality in this country.
The study established that adopting community dialogues is effective for increasing family planning use from 30.2% to 37.6%.
We still have about 189 mothers dying per 100,000. We really would want to do to reduce that. We still have children who are born. So we really have a lot of work. So that we do not just say that you've got a PhD, but we'll be able to say that what has it contributed.
Her research was supervised by Professor Christopher Garimoy-Orach, Associate Professor Lynn Atuyambe, and Dr. Elizabeth Nabiwemba.
You have joined the table of mentorship. You have joined the table of humility.
Dr. Achola's directorate was received with excitement in the entire Kwa Adola Kingdom, whose king Kwa Adola Moses Stephen Owor graced the Thanksgiving ceremony in Kampala. The Thanksgiving ceremony, held in Namugongo, a Kampala suburb, was preceded with a mass at the Basilica. Currently, Dr. Achola is a technical advisor on sexual reproductive health and self-care at the Ministry of Health.